You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, nutrition, and sports performance. Stay up to date and listen anywhere, anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your hosts, Dr. Justin Marchegiani and Barris Harvey, as they answer your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hi, this is Dr. Justin Marchegiani here. Welcome back to Beyond Wellness Radio. We have with us in studio Mike Hoban, and I'm looking forward to a great chat with Mike. Mike is a strength and conditioning coach. He works with athletes at the collegiate level, the professional level, and even kids in middle school and such. Mike also works with ARPWave technology, which is a great technology for injury prevention and to speed up healing. Before we go to Mike, I just want to remind everyone to check out beyondwellnessradio.com where they can get the show updates. Feel free and click on Ask a Question, and you can ask a question for us, and we'll answer it on the air. Then also check out justinhealth.com as well as fixyourthyroid.com for your female hormone and thyroid balancing video series. Again, Mike, how's it going, man?
Awesome, Dr. Justin. Thank you for having me.
Yeah, it was great catching up with you back at the Bulletproof Conference in September. And I just thought your lecture on muscle activation was just phenomenal. So if anyone didn't get a chance to view it, can you just kind of give us a summary of what you talked about and about muscle activation?
Sure. Basically, all muscular activation really is turning on a muscle that's been shut off for whatever reason. So there's many ways to do it. As you know, we're both trained in a similar fashion. Mm-hmm. But what I tried to put together was a method for people to basically be able to reactivate the big three muscles on their own. So the big three muscles were the psoas, mm-hmm. also known as the hips, the glutes, and the hamstrings. And that's all it really was. It was just a matter of showing people what points to press on to reactivate those three muscles to get optimal performance and better movement throughout the day.
Now, during the seminar, you had people come up and you were testing their psoas, testing their glutes and their hamstrings and their hip extensors, and you were finding ones that were weak and weren't turned on. So when you find a muscle that's weak, what does that mean? Is it like, is the person just not weak, or is it like the person just not getting the activation there? Can you describe that?
Yeah, essentially what it is for whatever reason, the muscle is shut down and gone into a protective mechanism. Yeah. So when that happens, obviously it goes into a short, basically like a wound up position. So think about like if you're in a fight and someone's about to hit you, you cover up, you kind of tuck into a position where you're safe. Yeah. Your muscles do the same thing. So by activating it, you restore them to their normal length and they fire properly and basically operate at a higher level.
Right. So you see people that still are strong, maybe from a hardware perspective, right? The hardware is strong, mm-hmm. The muscle is strong, but from the software or the operating system perspective, they're not neurologically strong. Is that what I'm hearing?
Exactly. And I mean, to give you an example, the first time I learned about some of this stuff, I was studying with Dr. J up in Minnesota. And I mean, I'm a decently strong guy. I can still squat between, 500 and 600 pounds.
You're a beast, Mike.
Not the beast I used to be, but I appreciate that. And he threw me on the table to test me, and my psoas, which is a large muscle, as you know, I couldn't hold him up. He pushed me down with two fingers and then proceeded to make fun of me for the next 30 minutes.
Got it. So let's say I come into you, right, and I to see you, and I have a weak hip flexor, right, weak psoas, weak glute, weak hamstring. What would you do? How would you assess me?
Well, we'd put you on the table, basically do, a basic therapy table. And we put you through a whole series of muscular tests. So basically everything I did at the conference, you have people lay down, you put a limb in an extended position and apply force to it, not in a dangerous method, but in a way basically just to test to see if the muscle's working properly or not. And from there, you get your response and see what you need to do.
Now, from what I understand, the points that you're hitting these neurolymphatic points. And just for people at home, if they put their hands in the back of their head, and they feel that little ridge in the back of their head, that's one of the points that Mike accesses. So that little ridge right in the back of the head, and you kind of find a real painful spot. And there's also one more right at the angle of the jaw, right where the jaw meets the neck, and it's like right kind of behind the earlobe, and it's that really sensitive spot. Now those those correlate towards your glutes and your hamstring. Now, I know, again, a lot of people may not be able to get tested for their glute and hamstring, but can you talk about how they would activate their glutes and hamstrings with those points?
Yeah, basically just what you talked about. You feel around that ridge at the back of the head and the point behind the jaw, and you look for sensitive spots, and those sensitive spots are signs. Whenever those spots are, tender or feel sensitive, as we've said, that's a sign of how shut down that muscle is. So when you access them and you put pressure on them, eventually those spots become less and less sensitive to the pressure. And that's a sign that your hamstrings and your glutes are firing better. And most people will notice a difference, especially with my athletes. When I test them, they'll be able to work on themselves. And we notice, their times are faster and they're lifting more weight and they're doing things with better technique as well.
Right. So I see a lot of my patients, and they may have like shut down psoas or shut down hip flexors, right? Glutes.
Mm-hmm.
And it's nice because we can say, hey, this is the spot to rub. So you may be like treating them. You may be doing like some muscle spindle work or using the ARP to get some of these muscles activated. But the nice thing about these spots is you can actually give them, exercises or just to rub during a movement right when they're at the gym, or if they're a baseball player at the plate, you can give them movements in exercises to do right during the at-bat or right during the movement to stimulate the muscle. Is that correct?
Oh yeah, it's a take-home system, and it's something that works very well. People can it really helps to exacerbate, whatever type of therapy you or myself are, putting the individual through. It helps to basically solidify it, is how I look at it.
And I remember when you treated me, I'd say about a year and a half ago at the first Bulletproof conference, you did a maneuver where you were testing the oblique muscles. So
Yep.
the oblique are the abdominal muscles, and you were twisting me or turning me. So anyone that throws a baseball or hits a tennis racket or swings a golf club or swings a baseball bat, again, that's the core muscles that are going to be turning your hips. And I remember with me, you had me rub the inside part of my adductors or my growing area, and I was like 10 times stronger. Can you talk about that move and how people could do it at home?
Yeah, it's a very simple technique. I mean, it's the easiest way to test it at home would probably be to because you can test your abs on your own. I would say do a sit up and see how long you can hold that position. So try to get to a 45-degree angle and try to stay there. And most people will have difficulty doing this. They're going to have to either, start compensating and using their tibialis or, using their arms to help them stay up there. And the activation itself is really simple. It's you put your hands to the inside of your legs and you basically rub up and down. What we say with the male athletes is you rub knees to nuts. Pardon my French.
Oh, man.
And you do that for about 10 seconds and then you retest. And that's a very, very quick activation. And people see results very quickly with it. And that's all it takes. And most people can hold that position. Probably if you held it 10 seconds the first time, they'll probably hold it 30 or 40 seconds the second after the treatment.
Got it. So we just did the obliques there. We did the extensors, the glute and the hamstrings. And by the way, is it the one on the back of the head? Is that the glutes, or is it the one on the side of the jaw?
The jaw is the hamstrings. The back of the head is the glutes.
Okay, got it. Are there any more of those points that you know of that someone listening to the show would be able to use right away?
There's a bunch of them. Those are the big three. Those are the main three. Probably the other one that's the most important would be the psoas activation.
And where's that point?
That is medial to, I'll just use layman's terms, the hip bone.
Yep.
So the ASIS, you would come medial probably about an inch to 2 inches and start looking for a tender spot there.
So for anyone listening, put your hands kind of like where your pockets would go and feel for that really bony prominence that kind of sticks out. That's the ASIS, and go in 1 inch.
Mm-hmm.
Perfect. All right, cool. And then everyone, you're just rubbing that or stimulating it for what, 5 or 10 seconds?
Yeah, you want to get pretty deep on it. You want to use, relatively speaking, 8 to 12 pounds of pressure because you have to, if you're a little bit of a thicker individual, you probably need to push a little harder.
Got it.
Because you do have to stimulate that nerve bundle, but you have to get in.
Got it. Okay, cool. So Mike, tell me about some of the athletes and some of the people that you work with. I mean, I know you work with a lot of professional athletes as well.
Mm-hmm.
And what are the things that you're doing to help people get to the next level, get drafted, to play at high professional level?
Well, the biggest thing we do is the minute the individual walks in the doors, we start with an evaluation.
Okay.
And we look at I look at so many things. I don't even know where to start. I train a lot of pitchers,
Mm-hmm.
and so pitchers just about always have what I just refer to it as a pitcher's retro version. It's basically their push leg is always, that ankle is always sprained.
Ah,
And yeah, and it's not because they've actually sprained it, it's the position it goes into when they push off the mound.
yeah.
So if you ever look at that, a pitcher actually rolls his own ankle in the opposite direction from where he's throwing the ball and the way his body's going because of the rubber, the way they use the rubber off the mound.
Got
And
it.
so that's one of the things we end up doing. We end up doing like a tib fib technique, which I
Yep.
don't know if your audience is familiar with that, but we basically just throw a little tape on the ankle, and that makes sure that all those muscles in the leg keep firing in the proper method. Once we do that, that's kind of what we consider, ground zero. When everything's firing properly and working, that's when we go into, the basic strategies of training and whatnot.
Great. So just to describe to everyone at home, the tib fib technique Mike's talking about is a shock absorber technique. Essentially, you're taking the tibia or the bottom part where the calf is, and you're whacking the heel. You're whacking the heel in right towards the tibia, kind of like you were running, and you're simulating force going to the joint. Because how the body is lined up is if force does not get absorbed properly into the joint because the joint isn't stable, it actually sends nerve signals to the brain to shut down the muscle. If the joint's stable, it will send signals to recruit the muscle. So what Mike's talking about is whacking the bottom of the heel right in alignment with the tibia, and we test any other muscle in the body, and it will shut down if that joint's unstable. And this is important because an ankle issue can cause weakness anywhere in the body. You could probably take 5 or 10 miles per hour off the fastball.
Oh, easily. It can do that, and it can add close to half a second to a 40.
Wow,
Yeah. Yeah.
unreal.
We've seen that if they're in a fatigued state and they've been going for a while, and yeah, their 40 time will drop dramatically.
Now, I find that's a huge thing in the athletes and the professional people I see is the tib fib. Is there anything else like that you would consider like a deal breaker?
Ooh, good question. Probably, again, because I deal primarily with baseball players, but I see it in every sport. There's always a pelvic imbalance.
Yeah.
And that's because it seems no matter what sport we're into, there's always one side that's favored over the other.
Yeah.
So that's a big thing we need to restore right away as well.
Got it. And can you talk a little bit more about diet and kind of what you are teaching your athletes to eat?
Well, the high school kids, you basically just pray that they're not stuffing Chipotle down their neck 24/7.
Right.
But as far as diet, the main things we look at are adequate protein intake, good essential fats, greens, which is, a war in and of itself with these people, and proper hydration. Those are the 4 basic things we look for initially. After we kind of get those things in line, that's when we can start to move on to the more complex stuff. But you want to start, diet is one of those things where it's as much psychology as it is physiology. And you really have to kind of give people what they can handle because food is a very sensitive subject with a lot of people.
Right. And can you touch upon protein? What are your recommendations for protein for people trying to put on muscle or athletes and such?
It depends on the individual. It depends on how quick their metabolism works and, how often they're training. Are they in a sport? Are they out of a sport? For the sedentary athlete who's training, about 3 times a week, and we train hard, we do lift heavy weights.
Yep.
We try to get them to get a gram of protein per pound of body weight.
Yeah, that makes sense.
Yeah, whether that actually happens or not is another story.
Yeah.
Like I said, especially dealing with high school kids, because cookies are so much tastier than a protein shake. But
Yeah.
we try to make sure they at least, while they're here at the facility, they're drinking their protein and doing what they're supposed to do after their workout, and taking their supplements during the workout as well.
That makes sense. That makes sense. And talking about supplements, are there any supplements that you recommend for training or to improve performance or stamina, things like that?
The biggest thing I recommend most people use is a good omega-3.
Yeah.
Aside from there's certain staples we always recommend. Things like we always recommend magnesium, we always recommend protein powder, and omega-3s because you want to keep insulin and inflammation at, in proper levels. We're always going to have some level of those, but you want to keep them in the proper level. Like I said, protein and magnesium, I think, is huge just because that's the nutrient of insulin sensitivity. And it also, there's just so many functions in the body that magnesium helps with.
Got it. And you're obviously trying to cut grains out of these kids' diets too, right?
Yeah, you want to eliminate all the bad stuff, but like I said, it's a very gluten especially because tying into the inflammation. But like I said, it's got to be a slow process because you have to kind of give and take, if you know what I mean. If I
Yeah,
take something out of their diet, I have to give them something back somewhere along the line.
got it. So let's say I'm an athlete or I'm a person, I'm trying to run faster or sprint faster. Like,
Mhm.
what are the things you would look at in my kinetic chain? What would things be you want me to do in my exercise routine so I could sprint faster or move faster?
Well, we'd have to look at what's going on with you up first.
Okay.
So if you need to sprint faster, I'm going to guess there's a problem to begin with. So 9 times out of 10 with the kids we see, they're what we call push runners, where they're relying
Mm,
on the musculature to the front of their body. So they try
mm,
to run from their quads and from their psoas, which just doesn't work. That's not how we're designed to. That's not our muscles of propulsion, so to speak. So first thing we would need to do in that case is get them dominant back to their glutes and their hamstrings. And from there, we look at ankles, we look at rotator cuff, we look at how everything fires properly, what type of posture you're in. So just to give an example, because I'm kind of rambling here, first thing we would start to do is strengthen the ankle joint. So I like to do a lot of barefoot stuff. So
yeah.
we have the kids kick off their shoes and they start doing things like line hops, which is an exercise as simple as it sounds. You just hop back and forth over a line on one foot.
Yeah.
Another thing we'll do is like trampoline squats, where they have to basically engage the muscles in different planes.
Yep.
And anything, even like toe walks, basic stuff where they're just up on the balls of their feet and recruiting the muscles properly and squeezing their glutes as they step, because that's going to teach the body basically how to land in the right position and propel itself properly.
Got it. Got it. And it's fascinating what you said, because I find a lot of people, their glutes and their hamstrings are off, mainly because they're just sitting all day, and that
Hmm.
and that psoas basically reciprocally inhibits that glute muscle, so the whole
Yeah.
extensor chain in the back is just shut down, right?
Definitely, definitely. And it's a lot of it I find with these athletes is we start these kids at such a young age in some of these sports, like, for example, soccer, where it's a stop-start sport. And these kids don't know how to decelerate on the glutes and their hamstrings. So they start relying on the musculature in the front of their body. And that develops kind of a push-run syndrome.
Got it. So if I'm a person, athlete, or even just a regular everyday person coming to see you, you've talked about the ARP wave technology, which is
Hmm.
it's a specific bioelectric device that I know you use with your athletes for performance enhancement as well as injury healing. How would you incorporate that into your program?
Again, it depends on the individual.
Okay.
But one thing we do like to do is the loosening is probably the best function on that machine.
Yeah.
So pre-workout we loosen and post-workout we loosen. Doing it in the beginning gets the muscle to go back to its original length and the myofibril goes back where it should, which
Mhm.
allows for better range of motion for most people. And it allows for the muscles to fire properly as we're talking about. That works much better once the muscles are activated. So whether someone's put in balance or do the neurolymphatic points, they get even more range of motion from loosening after we've done that. Post workout, what it really does is it helps restore the muscle fibers and reduce soreness, which is that's huge for most people because they feel like they've worked, but they don't feel like they're dead the next day. And that's really like a psychological lift for a lot of people.
So you just said something very interesting. I never thought about using the ARP, the electricity coming through over those neurolymphatic points. So you're saying you get
Mhm.
great results using it over the points as well.
Yeah. You can do that, or you can just stimulate the points prior to.
Okay.
I've done stuff where like because you can arc your own hand and do things like ART. I've
Yes.
actually arced my own hand and done some activation points on people. They weren't overly appreciative at the time, but they were afterwards.
That's
they were
great.
they were a little angry with me during the process, and when they found out they were a lab rat, they were really angry. But after that, they got over it.
Nice. Now you mentioned like loosening, which we're using the current to loosen the muscle. We're using it afterwards to help, regain elasticity after the workout. What about during the workout? Are you putting current into the muscle to see if we can recruit more muscle fiber during the movement? Do you do things like that at all?
On occasion, we'll do some gamma loop stuff where we'll put we attach it to an extensor to get a response from another extensor. So one of the things that's kind of known in the ARP community is if you want to get the hamstrings to fire more, you put the ARP on someone's triceps.
Ah, okay. Can you talk more about this gamma loop? This is fascinating.
Okay, so the gamma loop is basically, to put it in quite simple terms, all extensors in our body are related and all flexors in our body are related as well.
Okay, so kind of how we embryologically form, the extensors are related together and the flexors are, right? That's what you
Yes,
said? Okay, got
yes.
it.
So by attaching the arc to one extensor, you're going to get a response in all the extensors. So by putting it on the triceps, which is an elbow extensor, you'll get a response in the hamstrings and glutes, which are hip extensors.
Got it. Okay,
Mhm.
that makes sense. And if we did bicep, that would be the bicep and the psoas?
Well, bicep and the psoas and the quad too a little bit, because the
Okay.
quad does act as a hip flexor at times.
Okay, got it. Very interesting.
Mhm.
All right. So is there anything else you wanted to touch upon that you find is just very helpful for people trying to perform better? Like just key foundational things.
I think one exercise that's very underrated for most individuals, and we don't do enough of it because it's not really a sexy exercise, is the Superman.
Ah, okay. Can you talk about the Superman? So how does that work?
So basically, the Superman is just an exercise where you lay on your stomach face down and you lift your opposite arm and your opposite leg and reestablish what's called a cross crawl pattern, which is something we kind of lose
Mm.
because in our society as kids, we're brought to our feet too quickly. We're not allowed to crawl and really establish those proper neural patterns. And that kind of messes us up later in life because people, how can I put it? People want their kids on their feet, too quickly, and they establish poor patterns at such a young age. We have to break them later on, as they become athletes and when they want to progress.
Absolutely. And for anyone listening to who's a parent and has children, don't force your kids to walk too soon. Don't try to pick them up and have them walk. Don't put them in a jolly jumper that actually destroys their cross crawl neurological system. It screws up the development of their cervical curve of their neck because when they crawl for that, 12 to 14 months, you develop that
Hmm.
cervical curve because the child has to look up. I agree. I see so many people these days where they're just like pushing their kid to walk so soon, thinking their kid's like an Einstein because they can walk sooner. I'm like, no, you're pushing them through important developmental periods.
Exactly, and it's one of those things where like they say, you need to learn to crawl before you learn to walk. We're kind of skipping that step.
Yeah, I was like looking at family pictures recently and I saw me in a jolly jumper, which is the things that attach to the doorway and then you jump up and down in them. And I was like
Hmm.
6 months old and I'm like, oh my God, my neurological pathways aren't developed. I'm like, oh man.
Yeah, I think my parents just kind of used me as a soccer ball when I was a kid. That's what messed up my neurological patterns.
So when you see your athletes coming in, how do you make the connection that there's a cross crawl deficiency maybe when they were younger to their movements as an adult or a teenager?
Well, one of the easiest ways is have them run, and we'll see 9 times out of 10 some of these kids who've been put through these things I say put through these things when they're young, they'll actually try to run same arm, same leg, as opposed to doing opposite arm, opposite leg like we're supposed to.
You know what? That's funny you say that, Mike, because when I treat a lot of patients, every now and then I get a fair amount of patients when we're doing like we're working on the hip flexor or the extensors and we're kind of like marching in place, that the exercise what we're doing with the arc, and they're
Hmm.
marching in place and they just for the life of them cannot synchronize their hands and feet.
It's crazy, right?
It's like no, like this and then do this and then we just try to break it down really slow. There are some people I have to take their arms totally out of the equation because they cannot sync them up.
Yeah, and it's funny because if you actually do a muscle test on someone, say you test their shoulder and they test
Yes.
strong, if you have them march improperly, so like right arm, right leg, left arm, left leg, and you have
Yes.
them do that 5 or 10 times and you retest that arm, it'll be weaker.
Oh, really? I
Oh
didn't even
yeah,
know. Oh, wow. Yeah. That
yeah,
totally makes sense.
yeah, because they'll actually shut down their own neural system.
So if they're doing left arm, left leg, or right arm, right leg at the same time, it shuts down the neurology.
Oh yeah, it'll weaken it to a point where you can push that arm down with 2 fingers. It's crazy.
Wow. Wow. Unreal.
And and the funny thing is to reestablish it, if you shut it down in 10 strides, it's going to take 20 strides to reestablish it.
Ah, so you have to put more feedback into the system to kind of correct
Yep.
itself.
You got to really reboot it.
Okay. Well, I got an email recently from Ben Greenfield, and it was an article on sleep that he had written, and it was very
Hmm.
fascinating. And I wanted to kind of run it by you. How
Sure.
important is sleep for recovery in your,
Oh, it's
in
huge.
your athletes?
It's huge. Because I mean, that's where we secrete our hormones, growth hormone and whatnot to help our
Yeah.
body recover. That's when our immune system recovers. And it's also when our nervous system recovers. So sleep is enormous. I recommend kids try to get 8 to 10 hours if possible.
Got it. And is there a particular window in which falling asleep at this time is better than another time?
Well, I would say falling asleep prior to 11 p.m. for
Mm,
most people is good because of the cortisol curves we have.
yes.
So obviously, cortisol is kind of a I was going to say a necessary evil, but cortisol is actually our friend for part of the day.
Yeah,
But
absolutely.
yeah, but you want to have that secreted at a certain time. And when you're sleeping, it actually helps with some of the rebuilding process with regards to testosterone and estrogen and whatnot.
Got it. Got it. Okay. So now if I'm someone that's coming into your practice, and let's say
Hmm.
I'm not like a professional or college athlete, but I'm just someone that wants to be more active and wants to lose fat or lose weight doing the
Hmm.
absolute least amount of work, what would you recommend?
Well, if you're ready for it, and that's the big key, because you have
Got
to
it.
give the body what it's ready for and what it's
Right.
going to accept. If you try to go beyond that, that's when things like overtraining and injuries happen. But if you want the most bang for the buck, lactic acid training is probably where it's going to be at.
All right. So this is like similar to what Body by Science, I think, is it Dr. Doug McGuff? He talks about this stuff too.
I believe he does. Yes.
So if I'm an individual and I'm wanting to try this lactic acid training, and I think Polican also talks about it too,
Hmm.
correct?
Yeah,
So
Charles has a whole system on it. Yeah.
so how would I go about applying this and using it?
So what you want to do to increase lactic acid, you want to use big muscle groups and you want to go for long durations of time. Now, when I say long durations, I mean up to a minute. So if you're going to do it in a weightlifting workout, we would do something like a barbell back squat for, maybe 10 reps with a 4-second eccentric and a 1-second concentric. Do that for 10, rest about a minute, and you go right into an upper body exercise, say like a lat pull down, 10 reps, same count. And you want to basically establish as much time under tension as you can to increase as much lactic acid production as you can and increase the calorie burning.
Okay, all right, got it. So you would do that, and typically you would choose like squat movements. I know
Mhm.
Doug McGough has he does a lot of machine stuff. So would you do like a leg press? Um, what would you recommend?
You could. I mean, you could do a leg press. It depends on the individual. If you're someone who's working out alone and you're not really familiar with weights, then yeah, by all means, use a machine. If you're overweight, I would stay away from the leg press just because you're not going to get the good range of motion that you're going to need, and it's also going to push on your stomach and your internal system. It's going to cause a lot of pressure to go to your head. Probably not the best feeling in the world for most people. But yeah, machines are always a good option. You can do something. You could even do like a goblet squat
Yeah,
to start out, and then go right to a hamstring curl or something of that nature.
got it.
But yeah, so I would probably go just to lay one out really simply. Say like either a body weight or a goblet squat for a minute, and then take a minute rest. Go to a lat pull down. 10 reps, 4 seconds on the eccentric stroke, 1 second on the concentric stroke. Repeat that 4 times. Rest 2 minutes, move on to your next sequence.
Got it. That makes a lot of sense.
Hmm.
Now, there's a lot of emphasis put on, especially for weight loss, and I do it with my patients as well, which is like burst training or high intensity interval training. Can you comment upon that?
Yeah, I mean, it's a great concept and it works really well for people. Uh, you have to, again, going back to, I'm going to sound like a broken record here, but you have to go back to what the person is ready to handle at that time.
Right.
So sprints work great. I think for most people, it's finding the proper modality to do it in. I
Right.
know when I do my sprints, I like to use either like a recumbent bike or sometimes the rower if I'm feeling especially masochistic that day.
Haha.
And those are the two I tend to go with. I don't really like the treadmill for that.
Yeah, that makes sense.
Hmm.
Okay. All right. Now I'm going to go into some juicy stuff here.
Okay, we love juice.
I love it. I love it. Actually, on that topic, what is your opinion? Because I know you work with lots of athletes at all levels. What is your opinion on taking steroids? What do you see? I mean, obviously there are great gains in the short run. What do you see in the long run? What's your take on it? Just honestly, just off the cuff.
My take on steroids.
And just to be clear, we're talking about anabolic steroids
Mhm.
that you typically would inject for athletic performance enhancement.
Yeah, the stuff that's kind of the buzz right now.
Yes.
As with anything we take in this world, there's use and abuse.
Right.
So they can be taken properly and used to give an effect with minimal side effects, or they can be abused and you can completely damage yourself later on in life. I know of people that have really abused steroids for a long period of time, and now they have no testosterone in their body.
Right.
Their cortisol levels are so low that they're in constant joint pain because they have no way to suppress anything. So it's one of those things where you can use it, but at what cost? What's going to come later on in life? And I think that's the thing. Too many people are far too nearsighted, and they don't just use it, they abuse it. And that's what causes problems down the road.
And I work with a handful of professional athletes too. And one of the things I see, the main motivation why a lot of athletes use steroids isn't just for performance enhancement. It's because they keep on getting freaking injured. And I see a lot of people, it's like, who makes it through the college ranks and the minors or into the professionals. It's like, who can withstand the injury and the abuse to your body. And a lot of people are using these things just to heal faster from their injuries. What's your take on that?
I think it's a temporary fix to a permanent problem. Generally speaking, when people get injured in a sport, like let's look at a sport like baseball, it's because their body isn't prepped properly for what they're going to be up against. So, if you go into a sport like baseball or football where your muscles are imbalanced and there's an uneven pull on your musculature or on your skeletal system, yeah, as soon as you throw too hard or take a hit, something bad's going to happen. And something's going to pop, something's going to tear. And I think that's the thing people neglect. So taking a steroid to help yourself recover faster, okay, but what are you doing to remedy the actual issue?
Right. So basically steroids just stimulating the body to heal, but if the underlying imbalance, the underlying kinesiological, neurological imbalance is still there, well, it's like you're just putting a Band-Aid on a gaping wound. It's just not going to be enough to fix it.
Exactly. You're putting a Band-Aid on a ruptured femoral artery. It's nothing's going to change. You're still going to bleed out.
Got it. Well, I think we were talking earlier, and you're having this new site come up, and can you talk about this new site? What's the address, and what are the things you're promoting and offering on the site, Mike?
Sure. So we're going to have a website probably up in hopefully a couple months. We're still collecting a little bit of data and trying to write some articles. It's called MagniFit Science, MAGNI-FIT Science. And what we're going to do is we're going to offer some really quality supplements at a very good rate to the public. And we're also going to have some online training, and we're going to be posting, informative videos and informative articles on how to make fitness part of your life and how to easily streamline it in and make it not so much of a burden and make it kind of how can I put this, more convenient to people.
More convenient.
Yeah.
Got it. So if someone wants to work out with you via Skype, are you able to help people like that?
Yeah, definitely. We can write programs. We would just need to collect a little bit of data, and we can definitely send something out.
Great. Mike, is there anything else you want to share with our listeners that you think would be really beneficial at all that we haven't touched on?
Let's see. There's so many things. Proper supplementation, proper recovery, and proper nutrition will take you much further in improving your life than most people realize, I think.
That's great. Awesome, Mike. Hey, I think our listeners will love everything you have to say, and I really appreciate you coming on the show.
Thank you so much for having me, Dr. Justin.
Thanks, Mike.
Thank you.
Got a question for Dr. J? Go to beyondwellnessradio.com/question. Then tune in to hear the answer. Also, if you like the show, review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.